So the question you have to ask is what's in the curriculum? And we have learning objectives and competencies. Now, how great is it if somebody gives those to you? So you don't have to sit around and think about them and come up with them. Because I know when I sat around and did it, it took me a while to figure out these, but we're actually going to give those to you for each of the sections that we're looking through. We're going to give you a framework for things. So we'll talk to you about dental anatomy and how it would be enclosed in dental anatomy, how you bring in that course. The design of this whole thing is basically taking a first-year student and getting them familiar with all the technology all the way to the point where they get to the clinic. So with scanning technology and things and ability, the other thing that's nice about it is the way that it offers things. So it's an implementation strategy. So it tells you different ways and gives you options on ways that you might bring it in. So it's not one of these things where you get the curriculum and the expectation is that you're going to follow it from the front to the end. It's kind of a guide, per se. And it's going to give you examples. So for example, it'll give you laboratory exercises that you could use and how you would incorporate them and what you would do at each of those parts, depending on whether you're doing fixed or whether you're doing operative or you're doing dentures or you're doing dental anatomy. So it'll give you a framework for what that laboratory exercise might look like so that you have an idea about how much time it is and what kind of things are happening with it. It's built not just for dental students, but also post-grad. So there's a whole section on it just for postgraduate schools. So if you have a prosthodontic program, it's going to give you strategies on how you would implement it in your prosthodontic program.